Hey everyone, my name is Kelly Welsh. I am a renal dietitian for approximately 25 years, as well as the Ren.Nu Program coordinator. I have had PKD, been diagnosed for about 25 years, the same time.
I'm Thomas Weimbs. I'm a professor at the University of California in Santa Barbara in the Department of Molecular, Cellular, and Developmental Biology. My research lab has been focused on polycystic kidney disease for over 20 years. I'm also one of the founders at Santa Barbara Nutrients that makes product that's based off of the research we made in my lab. Yeah, so Kelly, let me ask you a question. You have been running the Ren.Nu program for a few rounds now. How many rounds did you do so far?
Actually, we are coming up on a year. I'm going into my 6th round, Dr. Weims. Yes, very exciting.
That's a lot of people with PKD that have benefited from your advice, but it also means you know a lot of people with PKD, and everyone is different. How many folks would you say is this, like almost like 100-ish or so, around that?
Yeah, right around there. I mean, give or take, every cohort is a different size, usually depending upon what's happening, when do they want to actually start their journey, what roadblocks might they have. But yeah, it's
Right.
right.
Okay, so I would say you're a world's expert in working with people with polycystic kidney disease, and I obviously have polycystic kidney disease yourself, so you really know what you're talking about. What are some of the symptoms people have going into the Ren.Nu program where they experience an improvement after the 3-month program?
Yeah, good question. There's quite a few. We talk about patients desiring to lose weight, we talk about high blood pressure, but the biggest improvement that I have seen and that we have actually looked at and dug into the numbers are pain. So many PKD patients experience pain that inhibits their activities of daily life. And some of the results from participants in the Ren.Nu program following this kidney safe ketogenic approach and using KetoCitra have seen such huge improvements in pain. And in fact, we did a survey among 40 participants now, or 45. Now remember, they've completed the 3-month Ren.Nu program within the last 2 years. 45 responders reported that they experienced pain or discomfort due to their PKD, so be prior to starting the program. Now, this is where it becomes really, really exciting. 85% of those participants who reported prior pain and discomfort, 85% reported some sort of improvement, either greatly or somewhat improved after their 12 weeks in the Ren.Nu program. This is huge. Improvement of quality life doesn't even begin to explain the celebration in this and the milestone of them reaching that.
Yeah, I think that is really, really important, especially for someone with kidney disease who has pain. You cannot just simply take painkillers lifelong, right? Because these painkillers, they can be very harmful for the kidney. They make your kidney disease worse. I mean, there's something like ibuprofen, but anyone with polycystic kidney disease should stay away from that, for example. So those folks with polycystic kidney disease and pain are sort of like in a bind sometimes because there's not really anything they can do about it. So I think that is amazing. You've seen very significant improvement in pain levels just by simply these dietary changes and using KetoCitra, which is probably not something that a doctor can help, because all they can do is say, oh, okay, you can't really take ibuprofen, maybe take a little bit of this, a little bit of that, but try to stay away as much as you can. And that means patients are stuck.
And honestly, when people start out in the Ren.Nu program, I don't think pain is on their radar of something that's going to be improved, right? Usually their motivation is, I want to maintain my function, I want to increase my function, but to experience not a number improvement, but to experience a physical improvement that affects you every single day, that is such a big win for many of our participants.
Excellent. Yeah. I think this by itself is already makes it all worth it. And obviously we're hoping people will have sustained improvement in their kidney function, in their metabolic health and so on. And those are all parameters we're looking for as well in our clinical studies. But pain is definitely an important one. So in our clinical studies, there are pain questionnaires, for example, to keep track and try to quantify changes in pain levels. Yeah. All right. So Kelly, you're a renal dietitian. You run the Ren.Nu Program. How can people that are interested in working with you or being part of the Ren.Nu Program, how can they find you? Where can they find more information?
So Ren.Nu has its own website, which you can find more information there. Sign up for the next program or sign up for a free call to talk with me to decide if the Ren.Nu program is right for you, if you have further different questions, things like that. Also find us on our PKD Nutrition with Ren.Nu and Santa Barbara Nutrients on Facebook page. You can see me and some other Ren.Nu dietitians as well as Dr. Weimbs on that page and contributing. It's a great tool for education. All right. And Thomas, it is always lovely to talk with you, pick your brain. I know that I speak for all the PKD patients out there that we appreciate so very much the research that you do. Where can people find you? Where can people find your research?
I mean, one popular way of staying up to date with our research and everything that's going on is to join my lab's Facebook group. Just type in Weimbs Lab, search for that. Anyone is welcome to join. You can also head over to the Santa Barbara Nutrients website. There's a lot of resources and information there. I highly recommend the Santa Barbara Nutrients YouTube channel, where there's a lot of content there as well.